The House Families and Veterans Committee will come to order. Would the clerk please take attendance?
Chair Schmaltz.
Here.
Representatives Wozniak.
Here.
Fox.
Present.
Johnson.
Here.
Thompson.
Here.
Pavlo.
Here.
Wolford.
Present.
Young.
Here.
Burns.
Here.
Reingen.
Present.
Song.
Present.
Madam Chair, you have 11 members present, a quorum.
Thank you, Mr. Clerk. Representative Young moves to adopt the minutes of the August 19th meeting without objection. So ordered. Our first order of business is to adopt the H1 substitute on House Bill 4750. This sub as the appropriate contact at the Supervising Child Placement Agency after the child in foster care to expand notification of actionable changes. It also inserts components required under the financial literacy training. Rep. Johnson moves to adopt the H1 substitute for HB 4750. Will the clerk please take the roll?
On the motion to adopt the substitute, Chair Schmaltz.
Yes.
Representatives Wozniak.
Yeah.
Fox.
Yep.
Johnson.
Yes.
Thompson.
Yes.
Pavlo.
Yes.
Wolford.
Yes.
Young.
Yes.
Burns.
Yes.
Reingen.
Pass.
Song.
Yes.
Madam Chair, you have 10 yeas, 0 nays, 1 pass. The motion prevails.
We have one card to read in. Josh Pease is opposed to 4750. He's with the Children's Law Section, Michigan State Bar. Rep. Pavlov moves to report HB 4750 as an H1 substitute. Will the clerk please call the roll?
On the motion to report, Chair Schmaltz.
Yes.
Representatives Wozniak.
Yeah.
Fox.
Yes.
Johnson.
Yes.
Thompson.
Yes.
Pavlo.
Yes.
Wolford.
Yes.
Young.
Pass.
Burns.
Pass.
Reingen.
Pass.
Song.
Pass.
Madam Chair, you have 7 yeas, 0 nays, 4 pass. The motion prevails.
Thank you, Mr. Clerk. The vote has passed, and HB 4750 is reported to the floor with recommendation as an H1 substitute. Our next order of business is to have a presentation from Ann Rudisil, founder and CEO, Downriver for Vets, to talk about veteran benefit screening and tiny homes projects. Ann, you can start whenever you want. Just push the button so the mic is on.
First off, thank you for inviting me. Thank you for taking the time out of your day to listen to a veteran. I'll give you a little bit about myself. I'm a United States Air Force vet. I was in during Vietnam. I spent 4 years in the military. I was stationed at Peterson Field, Colorado, and at the Air Force Academy. I started a nonprofit in 2017 for veterans in Wayne County because I found there was no resources for them. I was supposed to retire 6 years ago. That didn't work. I am here today not to ask for any money. I am here today to see if we can get some of the guidelines and some of the rules changed for veterans. We are in the process right now of trying to, we were calling it tiny homes. We're away from tiny homes now. We're going to start calling them prefab because people seem to have the wrong idea of what a tiny home is. So prefab homes, if you've ever looked or Googled them, they come already assembled, and you can buy them as low as $18,000. So we're going to that, but we're having a hard time finding land. I did have a paper that Ms. Thompson handed out. I apologize, it did not bring enough. But there are approximately 2,500 homeless veterans in Michigan. My goal here today is when you get out of the military, they give you your DD-214 or freedom papers. When you get out of the military, a lot of our veterans have PTSD. They end up getting a divorce because their wife found somebody else while they were in the service. A lot of these veterans end up out on the street. I've seen a lot of cases where a veteran with 3 children comes home, the wife says, I don't love you anymore, I've got somebody else. They get an attorney and they get a judge, and all the wife has to say is he has PTSD. He loses his children, he loses his home, his integrity, his pride, everything is gone. Veterans, when they get out of the service, especially the Vietnam vets, have no idea what to do with themselves when they get out. Anybody that's been in the military knows when you go in, they tear you down, they make you exactly what they want to make you. But when they let you go, you're still that person who gets up at 5 a.m. in the morning, who does routines, who eats at 12. Everything is regulated in your life to where when you get out, you can't do it anymore. And we are finding our veterans on the streets because of PTSD. My goal right now, as well as searching for areas to put these prefab homes, is getting these veterans registered. I don't think people understand how important registering a veteran to a VA is. Yes, when they come out, they can go to a VA and register. How many of them know that? If I have 10 veterans sitting in front of me, I can tell you 2 of them know what it is. We had an 80th birthday party for a veteran yesterday, and he has 3 different kinds of cancers, and he was Vietnam. And I asked his wife if he was registered, and she said, "What is that?" This man had boots on the ground. He's entitled to benefits, not having to be paid for his family. On the way here, I received a phone call, and I don't know how this one is probably not going to fare well. This woman called me, her brother has dementia. He's a Vietnam vet. I said, "Does he have a DD-214 freedom paper?" She says, "I don't even know what that is." She said, "He got dumped in my lap because nobody wants to help him." So if he doesn't have a DD-214, therefore he's probably not registered. He has dementia. Who's he going to talk to? Who's going to get questions out of him? Nobody. This is a heartbreak. I'm going to have to tell her I don't know if we can do anything. I am asking that something happens when a veteran gets out of the military and he is given a DD-214. Can you please register him at a VA in his town? It's not going to cost a dime more. If you go to the VA, you get it there. So what's the difference? It lets the veteran know that we care enough about them that when they leave the military, here's your VA card. Now you can ask the questions. What is this for? Well, this is so you can continue your care. You can get the benefits for the cancer you may have from Agent Orange or the burn pits. I'm asking that we do something to please get the veterans registered, give them that card before they get out of the military so they don't have to go to a VA hospital or run into somebody like me that says, "Are you registered?" and they have no clue what it is. That will also take care of the veterans that have the PTSD and the mental issues, the alcohol, the drug abuse. Our homes are not made for those type of veterans. Our homes are for the veteran whose wife threw him out on the street, the veteran who's living in an $800 apartment and now it's $1,200 and he can't afford it anymore. But we still help those veterans that have the PTSD and the mental issues by driving them to the VAs. I'm meeting one on Thursday in Ann Arbor who never knew there was benefits for him. I'm pleading from a family of veterans to please, please take these veterans in your heart and please help get it so that they get their registration before they leave the service. Like I said, it costs no more money. They do it anyway at a VA. So what does it cost? Nothing. But you could save so many veterans' lives by letting them know, yeah, we're letting you go. You're discharged, but we still care. So here's your card. Go get the help that you need. Sorry, I get pretty emotional when I lose veterans because of this. That's about it. Are there any questions for me?
Thank you for your testimony. Thank you for your service. And obviously, we want to help all veterans, as you know, and you're very passionate about it. And thank you for doing that. What do you think is the best way that we can make sure everyone is registered? What do you see as the perfect procedure for that?
I know, like when I got out of the military, they give you your packet. You're given your packet with your DD-214, and I'm sure Mr. Wolford could also help with this. You get your DD-214 and you pretty much get your, I got out in 76, so I don't even know how they do it anymore. But you get your medical records, you get your DD-214, you get your pay if you had any left, and I don't know if there's anything else, but it's all like your final timeline. It's like as you're walking out, it's like, here you go. Thank you for your service, blah, 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 blah. Here's all your paperwork. There is absolutely no reason that that card can't also be made up. You know what I mean? Like, the VA knows you're getting out. You're in the system. But why do you have to go to them and say, I'm in the system, please give me my card, make me a doctor's appointment, when half of these veterans that leave the military don't even know they have the benefit of that because nobody tells them. So they walk out with their paperwork out of a military base and stand there going, now what do I do? And if they have PTSD, who are they supposed to go to? So I think if it was part of the discharge paperwork, I don't see why it can't be done at a base versus a VA facility. Does that make sense?
Yes, thank you for that. It's so important that we make sure our veterans know where the resources are and what benefits they're entitled to. And any way we can get that word out is so important. Let's go to Rep. Wolford.
Thank you, Chair. Appreciate you. Thank you for your service. You neglected, I think, one of the most important pieces, though, in your opening. You forgot to mention who you're married to.
Oh, I knew this was coming. I'm married to a Marine.
All right, there we go. Anyway, my wife has the same problem, but she was in the Marine Corps as well. But thank you for being here. Thank you for your service. Thank you for the sacrifices that your family has made and continue to make. This is something that we're looking into with Congressman Barrett and others on what that transition looks like from the federal government side to the state. And I have a few ideas that I'll share with you offline on that, and some things that'll be coming down the hopefully here in the near future. A couple of things just to encourage you. We put forth hopefully that veterans will be able to get into our state parks for free. That's coming up for a vote.
Nice.
So we'll be able to see a lot of people who say they care for veterans. We'll be able to see it in real time on that. Also working with Battle Buddy, which is an app that helps these veterans get their benefits by just a few taps on a phone. And so thank you for being here. God bless you. Thank you for the work that you're doing. Have a nice day.
I do want to add one more thing. We have been working with the Detroit VA, and we have had one class already. We're going to get another one, and I'm sure you've heard this. It's called My Healthy Vet, and it's an app. A veteran can put his own login, own password, because I get veterans that'll call me and say, hey, I got to go to the VA to talk to my doctor, and I'm like, well, I can't drive you because of responsibility of being a nonprofit. So I'm like, are you on My Healthy Vet? What's that? You'd be surprised how many veterans don't know the things that are out there. So we signed up 8 of them already, and we're going to do another one. But this is also a thing like the VA card, My Healthy Vet. You don't have to call your doctor. You don't have to wait for them to call you your results for blood work. You don't have to make an appointment by picking up a phone. It's all under My Healthy Vet, under your login. And that's another thing we're trying to get, but that all ties into the VA because that is the VA.
Okay, Rep. Thompson.
Thank you, Madam Chair, and thank you so much, Ann, for coming all the way from Downriver to speak and tell us what you do. And Ann is a very proud woman. She definitely did not go into the thousands and thousands of things that she does for our veterans downriver when no one else would. So I wanted to ask you a little bit more about that. So tell us a little bit more about the prefab home project that started out, let's say it this way, started out as a tiny homes. Tell us about the support you received, the amount of donations that you accumulated for the ability to do that, and then what was some of the feedback that you're hearing from people in the communities when you had the opportunity to purchase land and then were not able to do so? What was the feedback that you were hearing about veterans?
So to give an idea, a brief, now remember the tiny homes are not tiny homes now. We're calling them prefab, but it's still the same thing. So a veteran moves in. They have to They get vetted by me. They have to have income. They will pay rent, just like everybody else does. They'll maintain their home. We'll maintain the grounds. After 7 years, they own the prefab home. If they decide to move out, they pass away, it comes back to DFV, and we give it to another veteran. Our problem seems to have been, and I don't like putting negativity out there to you because I want this to be a positive thing for our veterans. I went to 22 cities downriver to ask for land. 1 acre, 2 acres, just give me some land. Let me buy some land. The last one was in my hometown. While we were waiting for the council to discuss it, 3 people from the neighborhood came up. I had a Vietnam veteran with me, Victor, who is in Vietnam. He has Parkinson's and he's not very healthy, but he was one of the ones that's been with me since the beginning and has been rallying to get these homes for veterans. And this lady turned around as she was talking to the council, and she looked at me and she looked at Victor and she said, "I don't want them in my neighborhood." And Victor started to get up. I had to grab his hand and tell him, "Please don't do that. Don't insult yourself in front of them." And she said, "I live across the street from where they want the property." She said, "There's a liquor store down the street. Do I have to look at their beer bottles every day? Are they going to mow the lawn? Do they even care?" And I'm thinking, you know, you're talking about me. That's who you're talking about. And so we didn't say anything. And then another guy came up and he said, "My wife can't be with me right now, but we live around the block from where she wants to do this. And me and my wife are against this also. We have children. We don't want our children around them." We got up, as a matter of fact, the article was wrote in the Detroit News by a lady named Sonia. She put it in the paper. And 10 council people, only 2 said yes. And one of the ones that said no was an Army vet. That was the biggest slap in the face to me. We got ready to leave. I was told by somebody who has a very lot of money in that town that if he would have known what I was going to do, he would have called me and told me, "Don't bother, because they're not going to let you do this." And I said, "Can you tell me why? You have what do you call them? They have homes there for people with issues, group homes." I said, "But you can't let me put a military village? I can't put 4. They're like, they don't want you in our town." Could you imagine being told they don't want you? That's what 22 cities told us. "We don't want you here." And I said, we're not coming back to the city. I said, "Let it go. I'm not going to fight you. Because what are we going to do? What if we win? What if I put 4 veterans in 4 prefab homes and then your neighborhood goes after them? Or the kids call them names or some." I said, "They're going to flip out. It's not going to work." So we're back starting again. It is a big need. And if people would just, like Philip, I talked to Philip, I said, if people would just talk to us, you know, don't just assume that every single veteran that got out of the service is a wreck. And the ones that are not mentally okay, they didn't go in like that. We did that. So they get out and what we hear is, "We don't want you in our backyard." Who is you? It's me, my husband, my son-in-law. It's you, Rep. It's her father. It's everybody. So I guess you have to start at the beginning and get them registered. So if they do have PTSD or whatever, let's help them. Let's help them get better. And maybe that will ease some of the fears of people saying, "We don't want you in our backyard."
Well, Ann, one of the reasons that I wanted you to come and talk about that is one of the things, me being, you know, a second-term rep and being new to Lansing and realizing that I am responsible for state government, not local government, and I know a lot of us don't want to get involved with what's happening at the local level.
Right.
So what I found myself doing is letting my constituents know and letting local leaders know and letting organizations like you know that I will be the go-between between you and the local municipality. You know, maybe try to bring you together or work on common ground or be a liaison and advocate. So I think you coming before us, I hope that my colleagues would reach out to their local municipalities
Thank
and
you.
make those connections and try to be a good advocate, because I know your vetting process is extremely rough. We're not talking about veterans that are actively using drugs or alcohol or not employed. These are veterans that have pulled themselves together with your support and are ready to be put into homes so that they can thrive and that their family members
Absolutely.
can see them thrive, the family members that they have. And I applaud you for everything you've done.
Thank you.
Yes, thank you, Rep. Thompson, and thank you again for all you do. And it's a shame. Our veterans deserve a lot more, and I think it's important, Rep. Thompson, like you talked about, to make sure that the constituents in all of our areas at least sit down and talk to you about what you're doing and start the conversation and come to some agreement so we can help our veterans.
Yes.
Okay, Rep. Johnson?
Thank you, Madam Chair. I just want to apologize on behalf of horrible responses and treatment. Welcome to District 78.
Thank you.
I'll help you in our district. That's 4 counties.
Thank you.
And have you been able to meet with or have an advocate meet with Secretary Collins at the federal level? We will, Rep. Wilford, I'll be glad to help you with that, because I have met with him and he wants creative answers like that, just simple, practical solutions. Get them registered on discharge. Thank you.
Thank you.
I have one question. How many veterans have you placed in these homes so far?
We have one right now in a mobile home we purchased. We're getting another mobile home and we're putting another veteran in it. 90% of our money pays their rent when it goes up, because we don't have anywhere to put them. Where do I put them? In a tent? I don't have anything. So we pay for their rent. We pay security deposits, which just briefly, if we pay a security deposit, the veterans has to pay us back. The security deposit, that's only fair. But we usually end up paying for wherever they live because we can't build or put anything anywhere.
And how many veterans do you think you've helped so far?
Oh, gosh.
I'd say over 5,000.
That's unbelievable.
At
Thank
about
you.
5,000,
8 years that we've been
yeah. We have spent over $1.2 million since we've been going, and that's all donations. And I'm very, we have 2 accountants because ain't nobody gonna shut me down. Nobody's gonna shake my tree. I was supposed to retire 7 years ago and I didn't do it. So if I gotta do this at 70, I mean, nobody's gonna mess with me. But we help every single person that comes to us, and we have spent over $1.2 million. We've given away 57 cars. We're going Monday to pick up another one that somebody's donating. There's no end. I think we have about $87,000 sitting right now to start our prefab homes that we don't touch. And we are surviving on $27,000. That's what we pay the rent, buy the food, all that stuff. And when it starts getting lower and panics, then my crew does raffles, or somebody will do a fundraiser. They did a garage sale for us and raised $5,600 in 3 days. So every penny we get, it's money in, money out. That's how you run a nonprofit. You don't sit on it. Your money comes in and your money goes out, because that's what we did it for.
That's great. Rep. Young?
Thank you, Madam Chair. Thank you so much for being here, for all the good work that you're doing. I appreciate it. Thank you for Representative Thompson for asking you to join us today as well. I just, listening, I'm wondering, I know you said I'm not here to ask for money, so we're like a policy committee. Is there certain policy that you're looking for us to work on? I didn't hear that in your testimony.
I'm not sure. This is the very first time I've ever come in front of anybody, so if I sound really Duh.
You sound fine.
I am. I don't know where to go for this. I guess I would like, and like I said, I'm not you guys, so I don't know if my wording's correct. I would like a policy implemented. I would like something implemented that says, hey, you're going to be getting out of the military in 2 weeks. When your package comes along, we're also going to be giving you a VA card to be registered in your town. That's what I would like to see added.
Yeah,
If that's a policy, then I don't know.
Yeah, registering, I think, is important that she's bringing forward. And also, I think it's important for us as a committee to see what's happening around our state to help our veterans. So bringing people in like you help us see what's going on and where we need to work harder. So let's go to Rep.
Did that
Ryan
make
Pitts.
sense, ma'am?
Yes.
Okay.
Thanks, Chair. My question is a little bit related to what you were asking about the processing, and it sounds like, Rep. Wolford, you're trying to work on a better process. So that was one thing I was really concerned about that you were saying when folks get discharged, they need to still have continuity. And so this is like a federal state issue, and I'm just trying to figure out like where we as state legislators can help. So are you already meeting with the DMVA folks? So, I mean, Rep. Wolford is trying to help address that gap. That's like my biggest concern, hearing from what you're saying, that we could actually take action on. So thanks for bringing that up.
And it is, I mean, I got out in 76. They handed me a DD-214, my packet, and said, here you go, have a nice life. I got on a bus to go back to California, and I was like, I don't know, where am I supposed to go? What am I supposed to do? It took me 10 years before I even realized I had benefits. I don't have to pay for medical. I didn't know.
Rep. Wolford, did you want to comment on that?
I did, thank you. Just a couple of things as it relates to PTSD, and I think it's important to address this. A lot of times people hear that and they immediately think that, somebody can't function, they're unhinged. I want to just very quickly talk about somebody who's a straight up killer from the Marine Corps, a friend of mine. He's a machine gunner. I had brought up his story before. He had gotten blown up. For the sake of time, I won't get into all that. But when I say that he was a straight-up killer, he was fired frag grenades as they went into war. So you can imagine a lot of people died, and rightfully and justly so. However, he's the same person that when he came back due to reintegration issues, like almost, it's the same exact story. They come back, they're drinking. A majority of the time, they've lost their families. They're not quite the same. And so they drink, then they get pulled over, then they get another one, then they're in a system. And it's just this situation that we're in. But he's the same guy who, when a Hornet, he swatted a Hornet, and he told me, I don't want to kill anything again in my life. And he swatted a Hornet, and he ended up putting in a little box like this, clouds that he made with grass, and he was literally giving eye droplets to this Hornet. So when we hear PTSD and people are worried about these people in their neighborhoods, they're probably some of the greatest people to have in your neighborhood because they'll be your greatest protector. They're the most kind and most passionate people because they have seen the worst of worst. And so I want to make sure that we do not forget that. Absolutely. And a lot of time, PTSD, loud noises that they weren't expecting can shock them. And yes, they may act very quickly when stuff goes awry, but that's the way that they were trained, the way we were trained, and that can be a good thing. So again, thank you for being here. God bless you.
Rep. Pavlov?
And I really appreciate you giving us this information. It helps me a lot. In my district, I have Veterans Advisory Board, and it's run by a gentleman by the name of Patrick Thompson, who is a vet and very passionate, like you, about helping the vets in our area. In our last meeting about 2 weeks ago, the topic of counseling came up, and without exception, each one of them talked about counselors who spoke such broken English that they could not understand them, and also counselors who just did not seem to care about them, so they left the counseling process. What's your experience in that?
My son did 3 tours, Iraq, 1 Afghanistan. He lost every one of his buddies, all of them. None came back but him. So, of course, he had the guilt of PTSD. He went to drinking. He went to drugs. He was on Oxycontin, alcohol. As a matter of fact, I went to see him 3 years ago, and he almost killed him and I by almost hitting a truck. And I told him, I said, Sean, you have to do something. And he goes, they don't care. I go, who doesn't care? He said, I had a great therapist at the VA in Wisconsin. He said, I was starting to get the stories out, starting to let loose. He said they transferred her to a different state. He said, then they told me I have to wait for a new one. He said, it's twice now I've had to do this. They don't want to talk to somebody that is blind to what they've done. You don't have to know what they've done, but you have to have an open mind. Like a lot of my younger Afghan Iraqi vets call me mom because they'll come to me with issues from the war or whatever. And don't take this wrong because I have a unique way of dealing with them, but they'll come in with their attitudes and I'll say, you can sit the hell down and shut the F up now. And they'll sit there and I go, because right now I'm your mom. I'm your mom because you're acting like a child. You were in the military, you know what you're doing. And then I push them off to that. I have a board I've got 3 male vets. I push them off to them. They've been in the Iraq war. They were in Korea. They were in there. But that is what they tell you. That how come nobody cares enough to actually listen to me and help me? And yeah, you can't send them to talk to a foreigner. They're not going to talk.
I appreciate that. Thank you, Ann.
Rep. Thompson.
Thank you. One last question. So here, we know that Veterans Affairs is a federal issue, but we know as a state of Michigan, as Michigan legislators in the House of Representatives, give me your honest opinion of what we can do better, or if you think that the Michigan Veterans Affairs Agency is actually doing what they're supposed to do and taking care of our vets. Tell me the truth, Ann.
Okay. The VVA, I don't know how many of you have heard of the Vietnam Veterans of America, and the VOA has more money than DFE could ever possibly have. I get a phone call from somebody every single week. I need a car. I need a place to live. I need furniture. Who told you to call me? The VVA in Detroit. I have one of the guys' name's Bob. He runs part of the VVA in Detroit, and I called him up and I lost it. I said, how dare you, as a veteran organization, refer somebody to me when you know damn well I don't have the money? You know I can't do anything. The VOA has done the same. I belonged to the Detroit VA for 20 years. I left the Detroit VA, now I go to Canton. I love Canton. They have veterans that actually care about you when you walk in, your brothers, your sisters. I walked in there. They made me an appointment with my doctor when I was there. I have had every test possible that I've needed. They don't give you any grief. I love Ann Arbor. I love Canton. Detroit, I've been told they have a union. I don't know. That's not my thing. I don't really care because I don't go there. But the VVA and the VOA and places like the MVAA, they should be helping. And I don't know, like the VVA tells me, well, he wasn't in during the right time. So he just missed the right time by a year, so we can't help him. Or he went in too late. Or he got a general discharge, not an honorable discharge. And my attitude is, they're still a veteran. How do you just close the book on them and say, I'm sorry, you should have got out in '74, you didn't? So they don't help.
Do you believe if the government took care of our veterans like we should, organizations like yours would even have to exist?
Oh, absolutely, 100%. But I don't expect the government to take total control. We don't want the government totally in our stuff. Sorry, we just don't. But I think if the government knows, it's like people know there's a Salvation Army. People know there's the Michigan Veterans Affairs Association. There's the Vietnam Veterans of America. Why is nobody holding them accountable? I went to the VVA in Detroit and asked them if they could give us 30 turkeys for Thanksgiving. You know what they told me? oh, we don't do Downriver and we don't have any turkeys left. I said, you got more money than God. Don't tell me that. There's nobody to hold them accountable. Somebody should. You guys shouldn't have to do that work. Your whole thing that I want is to help push to get veterans registered. But somebody definitely, there is somebody that runs the VVA and somebody that runs the MVAA and the VOA, and somebody should hold every single one of them accountable just like I'm held accountable. Everything I have is online. Everybody can see what we do. I'm transparent. If they helped in our state, then maybe this wouldn't be so bad on our government.
Rep. Young?
Thank you. I figured I had to say something as the one member from Detroit sitting here in committee. I'm grateful. The way things get better is when people uplift what the problems are. So if we don't know, then we don't know what to fix. So this is kind of new to me that you can't even get turkeys, right? So, I mean, something that sounds simple. And I know people will tell you, well, this is not our area and this is not that. But we don't want to be passing the buck when it comes to the people who signed up to lay their lives down for us, for our freedoms. And so for that, I say thank you for uplifting it. And then if it's okay with you, I will follow up with you after committee.
Yes.
I think that's great. You two can talk about what we can do to better. All of our agencies, state level, local levels, we need to do more to help our veterans, and that's what we're here to talk about. So thank you for being here.
Thank you.
We appreciate your testimony. Thank you again for your passion and also for your service.
Thank you for being here and listening to me. And I must say prayers when I leave here that something changes and that we can really, truly help our veterans. Thank you, all of you.
Thank you very much. We have no absent members, so there being no further business before the committee will stand adjourned.